My name is Dr.Moses Mugonyi, the City Health in Mbale City, and I'm here presenting on the sub-program of health in human capital development. My slide. Plan, I think all of you have the page 2. You are seeing a number of my staff taking the seat of Mbale City to reach out to children for immunization. And this was an area called Musoto. Then the second one, we are doing home improvement campaign where we're in homes in Raso on how to put up basic sanitation facilities, including facilities for drying utensils, as you can see the picture number 3 on page 3. Then 4, the pictures in black and white, but this is one of the many campaigns within the city to make sure the city is very clean, such that in the near future we become one of the greenest cities in the country. This one was done with the support from students from Mbale State. We've had the School of Hygiene in Koma, but this was just one of them. So our vision for the department is to have a clean city with healthy people living a satisfying life. As you know very well, health is life. You cannot even sit here when you are sick, otherwise you will pray to Almighty to see whether you welcome you well or not well. So by virtue of being here, I know you are some of the people who are benefiting from our services as a department of health. And our core values: respect for every person, professionalism, accountability, equity, teamwork, and integrity. I'll be skipping the others, but there are some other things which I don't have to skip because I cannot skip this privilege of talking to the gallant ladies and gentlemen of Mbale. So basically, this is the sub-program of human capital development. It contributes to by putting up strategies that enable the population to live optimal health, so as to can contribute to the development of the city. And we do this by having the following services: preventive services, promotive services, curative services. And for those who cannot cure and have got disabilities, then we have to put up rehabilitative services in our facilities. And also do disease prevention interventions and also prevention of injuries as well. That's why very often you see me on the road, even sometimes I carry borders, put on helmets, put on reflectors. It is partly part of my work. And also being able to promote positive living behaviors, healthy eating, exercising, and avoiding negative behaviors which can lead to deterioration of health, like smoking, drug abuse, alcoholism. That's part of our work as well. And we provide all these services in 14 centers of excellence. We have 2 health center posts. We have 8 health center, 3 health center 2s, and 2 other center facilities which are owned by military and by police and prison. So altogether they are 14. Next page. Those are the priority areas. The first part is supposed to be presented by my colleague from National Technology Corporation, but we held up in some other meetings to present comprehensively in that area. So basically, but being a landlord of the city, of course, is providing all these services about water, sanitation, and hygiene, both at personal and community level. And we want to specifically make sure that the community receives safe water supply as well as safe food for human consumption. And thereafter, be able to manage the human waste which comes after somebody consuming all the nice foods we have in the city. Then also my office provides proper waste management in the city. I think very often you see me in the sun on the streets of Mbale, providing the sweepers, providing the garbage collection companies around the city. And the others I've already mentioned. Besides disease prevention, we also do early disease detection and treatment, and it is done in our facility. Of course, when a disease is discovered early, the outcomes are better and even they are cheaper to the patient and to the facility. And also on our side and to the side of the community, we have less chances of transmission of these diseases which are communicable. These are diseases which can be passed on from one person to another. They also provide what we call chronic care. These are for diseases which need prolonged care, like HIV, diabetes, hypertension. We make sure all these people are cared for through the whole life cycle. Then also link them to the services we cannot provide within our mandate, both within the city and outside the city. So for this financial running, we are going to renovate a former sub-county building in Maso to a health center, to a maternity ward, and it will cost us 115 million. Procurement is underway, and very soon we shall be doing the groundbreaking, of course, led by our political leaders for this project to start off. Then also we shall be able to procure 2 dental chairs and beds. Each one will cost us 18 million, and altogether it will be about 36 million for the 2 chairs. And also we intend to also procure equipment for examination and treatment of eye diseases. As you know, as we live for longer years, then we tend to invoke other complications, especially for the eye. That's the need to have this equipment in our facility. So for the year 2026-27, this is the income projection, what we call the indicative planning figures for health department, as seen there. We have in total 8.8 billion, and much of that money, about 7.5 billion, is for wages. I think you can read it, so I don't need to go through the figures. I might make a mistake. So the policy guideline for Ministry of Health is, one is you should be able to promote health. It has been discovered over the different studies that about 75% of the diseases we suffer from can be prevented by positive living and avoiding negative behavior. That's the need to have it as number one policy intervention of Ministry of Health. 2, we should be able to prevent communicable diseases and non-communicable diseases, including injuries among our community. Communicable diseases, these are diseases which can be passed on from one person to another. An example can be HIV, can be sexually transmitted diseases, can be malaria, but the vector which can lead the transmission varies from one disease to another. Then those which are non-communicable, these are diseases I cannot pass on to the next neighbor. They are basically what we call lifestyle diseases. For instance, if you have diabetes, I cannot pass diabetes to my next neighbor, including my wife, but it is a disease of me alone because of my lifestyle. And there are many of them of recent because of the change of modern lifestyle, including a lot of moving vehicles and borders vis-a-vis our forefathers who are walking long distances. I'm told one of my great grandfathers used to have a home in Bugerere, so he used to walk from Udadini up to Bugerere and there to come back. And he never died of hypertension and diabetes. But for instance, for this day, instead of walking, within a few minutes we are there and back. Then also increasing the capacity, of course this is by recruiting more staff. Already there is a running advert, we are trying to put up more staff to make sure we attend to these conditions wherever they occur among our population in the city. Then also we need to scale up disease surveillance. This basically means we have to have staff on the ground who have to go in our communities looking for people who may be sick, but they may not know that the condition they are having can be managed and treated in our facility. And we have, of course, structures on the ground called EHT, and very soon we are going to recruit more staff called community health extension workers. This will be on the government payroll, I think, starting from February next financial year. Then also we have to functionalize the existing facilities. As you can see, all over our facilities in the last 5 years, I think I've put 1 or 2 developments in all the facilities across the city. I know you can testify better. Not to mention a few other areas which may not be having other facilities, as I mentioned the challenges later on. Then also we are going to recruit more staff and also be able to procure and also source for more additional equipment and medical supplies. So the specific intervention for this forthcoming year is one, there was a very big concern of insecurity in Mbale Center 4, and it came up to the council of Mbale City, and one of the recommendations of the year moving forward is to be able to face the health center for Mbale. So that's why it's number 1 here. Then also we have a former building in Maruku which was hosting police. As we talk now, police have successfully got their own home, and I look forward to renovating that building to make sure it's a building for hosting my staff there. And also need to procure delivery bed. We have beds in a poor condition in Waso and in Samaga, and I'm always receiving complaints of mothers falling from this bed. And I'm scared I might be taken to court to buy and procure some of these beds. So we pray for us that we get this money and be able to buy these beds for this facility. Then of course we need to promote and recruit more staff in this forthcoming year. Cross-cutting issues, HIV, environmental issues, I think you can read. Deserving to mention the challenges. One is the much as I may have land for development of infrastructure, I'm handicapped in Namatala because of no land for expansion. And as you know very well, the land around Namatala is being saturated with buildings, and my office, my department is not in position to procure land for the expansion of this building. But nevertheless, I looked for some partners about 2 years ago and we were able to expand the maternity ward. That's why expand and also procure equipment. That's why we were able to get some space, but still in the full we cannot even go, we cannot even expand further. So moving forward, you give us better ideas on how we can acquire land for expansion of Namatala. Then we have other areas around the city, densely populated. Now you we live in a national forest in between, there's really no facility. And the catchment population there is about 25,000. And I'm challenged receiving late night calls of how mothers are stuck and they have nowhere to go. Sometimes they have to pick my car to be able to transport these people to where those areas where they can get definitive care. Then also, as we talk now, we have other areas around the city which are grappling with issues of garbage. Over the weekend, I moved in the areas of Kichafu, Commerce State, Soweto, Mission Cell, Mission Road. I saw very ugly things of garbage accumulating by our roadside. And I know in this house I have leaders from those areas. They should be able to give us great ideas on how we can overcome this challenge. Much as we have procured companies in these areas, we are still having people who are contributing a small fee towards the collection of this garbage. And they are spending much more by paying street children. They go and dump in rivers, they go and dump on roads, and if for how long arm of the law gets through, we usually take them in an ugly way, that's the word you can say. And sometimes they have to pay penalty for doing what they are doing. In turn, very expensive but not very for some of us. Then you also have areas which have limited water supply by National Water and Grid Corporation. But as I said earlier, I will tell you in this area because there's a lot of developments which are underway, and they will tell us where they are going and where they are coming from. They also have mega resources for the department, since we have a big spectrum of the service delivery in the city, both curative, cleanliness, and prevention of the state benefits all of us. And all this is done with only staffing level of 42%, which is 384 staff out of the desired 912 staff. So my staff are really breaking down. So when you go there and they are shouting at you, maybe they have become mentally sick because they have been overstrained by the work. Moving forward, we need land for expansion of Namatama because the land, the site is almost saturated. And we need to upgrade the national water storage system to meet the demand of the current population. As I said, national water engineers are coming to give us details of this. Then we need to lobby land, we need to lobby for a facility at Nauyo Kugema, Namavasa, and in Nakaloke Rural. And also we need to recruit staff because all these things are done with the staff in place. I think that's the short presentation from health.